an 8 to 12-minute discussion on this after the opening statements. Questions at the end, you know, for whatever first drugs and then whatever topics you guys
So
want.
for those of you who are interested in marijuana here, there's going to be an extra long discussion about drugs.
All right, so you guys went first on the opening statement.
I'm not one of those people.
Is there just marijuana policy or all drug policy?
We want to try to stick to pot. If you have some kind of analogy or you know example that relates, then we'll allow it. But the focus is on marijuana since that's the big debate in the country. So whenever you guys are ready, Yaf, give your 2-minute opening statement.
Got it. That was not the most comfortable place to be sitting in the audience, that particular debate. But okay, so we're going to give our opening statement now on marijuana policy. So occasionally you got this like trendy new idea that's rising to the surface of this collective political conversation that we're always having, and then everybody is suddenly sort of inspired to proclaim their support. You know, it's the fashionable thing to do. And marijuana legalization is really populous and it's very attractive right now. And I think kind of what we've done is forgotten to really slow down and thoroughly and responsibly kind of analyze the statistics and the research that's out there. It's really easy to get caught up in that utopic libertarian vision that, of course, we're interested in as well because we're interested in liberty. You know, at least I can speak for myself to the same degree. But what we want to do is really, like I said, sort of responsibly analyze, thoroughly analyze the facts. And that vision just doesn't square with the research. We want to keep the government out of our lives just as much, but the research says that, you know, the potential tax revenues, which are so appealing, they won't be nearly as high as the costs to the market caused by increased emergency room visits, car crashes, reduced productivity, and really what would be an unaffected drug war. So research on alcohol and cigarette taxation has shown that society pays at least 15% more money due to related accidents and injuries than it gains in taxation. And we don't see any reason that marijuana would be any different from that. Also marijuana use under the age of 18 has been linked to IQ reductions. The research shows that very clearly. And that can actually be more than 8 points. Kids in post-legalization Colorado use marijuana at a rate that's actually 50% higher than the national average. Getting a little excited.
10 seconds.
Oh, gotcha. Okay. So you got to consider the fact that that could possibly lead to a less effective workforce. Same thing with incarcerations. We'll get into that later. But sort of that idealistic notion that our problems will be solved rather than created by legalization, it just doesn't compete with reality.
Okay, your opening statement.
Okay. The United States has a prison problem. We have the highest incarceration rates of any country on earth, and we spend $60.3 billion on prisons each year. In federal prisons, 90% of inmates are in for nonviolent offenses, a majority of which are in there for drugs. In addition, out of the prison population, 40-something% is made out of black Americans, while the national population of the United States is 12% black. Black Americans are 4 times more likely than whites to be arrested for marijuana possession, even with similar usage rates in the two groups. In addition to the problems created by incarceration for drug use, drug prohibition, especially on marijuana, prohibits medical and scientific research that can provide benefits. A recently developed strain of medical marijuana called Charlotte's Web, which is high in a chemical called cannabinol, and low in THC, the ingredient that gets you high, has been used to treat epileptic seizures, used to treat Dravet syndrome, and it reduced frequency of seizures from 300 per week to 2 to 3 a month. Medical cannabis is also used to treat cancer, glaucoma, HIV/AIDS, muscle spasms, seizures, severe pain, severe nausea, and dramatic weight loss. In addition, hemp, which is the stalk of the marijuana plant, has been banned in the U.S. but can be used for paper, textiles, building materials, plastics, rope, biofuel, and food. That's food that doesn't get you high, obviously. By banning marijuana, we do a double disservice to our society. We put into jail minority populations who are already targeted and poor populations who are already targeted. We spend money on prisons that we don't need to be spending, but we also keep ourselves from having medical and scientific advancements and having a more stable economy where we can use hemp especially for all sorts of things that we aren't using it now.
Thank you. Let's open the discussion with a conversation about the cost for society. Which is more, takes more weight? The tax base that you can get from it versus maybe the possible healthcare cost implications and decreased productivity to society. So, you guys were first on the intro. You guys can start this discussion.
Okay. As I stated before, we spend an enormous amount of money on prisons, keeping drug offenders in jail. But the bigger part that isn't really discussed is the economic side of industrial hemp. When hemp is used to make paper, it is an annual crop. It grows every single year, and that's compared to using trees to make paper, which take 20 to 30 years to become full-grown trees. So you can produce 3 times as much hemp from an acre of land than you can, or hemp paper from an acre of land than you can from trees. That's a 60% increase in productivity if we legalized this plant in the United States. It is completely illegal to have even the marijuana plant in the United States, and that prevents industrial hemp. Also prevents the medical scientific breakthroughs. And when you have someone like a child with Dravet syndrome who has to go to the hospital, has to receive medical care for their syndrome where they're having seizures 300 times a week, that is an immense drain on society. In addition to tax revenues, being from the Libertarian side, we don't really like to talk about tax revenues that much,
15 seconds.
but that is another benefit. If it is legalized, it probably will end up being taxed, regardless of what we have to say about taxes, and that's another way that we can raise money for the government to use.
Time's up.
Guys?
Yeah, well, the first thing I'd like to say is that I think that there's kind of a confusion going on between your incarceration numbers, but the actual reality of it. Less than 0.01% are first-time possession of marijuana in our entire prison system. 0.01% of incarcerations. Now, while there's 800,000 arrests for first-time marijuana or for marijuana in general, 85% of those who are incarcerated are put in because they're dealing. So what you've kind of got here is you've kind of got an overstatement by a lot of marijuana proponents who want the problem solved by saying that our incarceration costs are going to go down so much, but in reality, most of it's not coming from pot. Most of it's coming from hardcore drugs. Same thing with the war on drugs and all the money we spend on border patrol agents and import checking and all that kind of stuff. It's not about pot. It's about much harder core drugs. The pot is only 20% of cartel revenues that come in each year. The rest of it's hardcore drugs. So what you've got to say is on some of these things is that pot really isn't what's costing the money. It's hardcore drugs that even have greater societal effects. That's not even talking about the healthcare of increased 3 times the amount of pot-induced driving problems that we've seen in Colorado and Washington. Higher costs from lower productivity in the workplace, lower IQ drops. I mean, all these things are huge costs that are not mitigated by what they're talking about.
And if I could just throw in a quick stat. So,
20 seconds.
Okay, yeah, 20 seconds. So for every $1 in alcohol and tobacco that we get out of tax revenue, we actually lose $10 on the social costs like car accidents and emergency room visits and stuff like that, just to throw it out there.
And okay, so I love the discussion about like the cost and benefits of drugs because he's absolutely right. There's like a lot of bias in both statements. Like for instance, you said that only marijuana use is less than 0.0%, something like that. I actually got data from the White House. Only drug offenders held for crimes only involving marijuana is 1.4. But you're right. You can play around with the data and see whether it's less productive or not. I'd like to make those points. First, the point regarding the IQ points of people below the age of 18 is mute because we're against it. Somebody has to be an adult to be able to consume this drug in the same sense that alcohol and tobacco, so that does not count. Regarding the cost of society, you're right, productivity might decrease, but we don't own our productivity to the state. Like to say that, it implies that we need to be good producers of society in the same sense that the healthcare cost. It's an absolutely good argument, and that's why we want to take government outside of healthcare. So once we can do that, you're absolutely right. It's a shame that we're paying for somebody else's problems, but it's not a question about the productivity, right? It's who's paying for the problem. As long as other people are paying for the problem, we think that is wrong. But the argument moves from marijuana use to a taxation issue, right? Because using marijuana is not inherently wrong. There's nothing wrong with ingesting a drug. There's nothing wrong with ingesting a drug, even if it has harmful effects on your body. It becomes a problem when it affects a third party. And as long as we have a government that socializes the problems, we will be against it. Go ahead.
Sure. Question I was just going to say.
Okay, so we're going to talk about if the government's going to take an approach, what should that approach be in the issue? I mean, how should it be penalized?
Yeah, focusing, for who should it be legal, how much, things like that. How
Should it
state,
be criminalized?
federal, yeah. Yeah, you guys can start since we're just talking.
I mean, I don't think there's going to be much contention on this issue because I think we're both going to agree that it should be regulated on the state level. It should be, if it's legalized, it should be children under 18, children under 18, exclusively for the kids. Nobody else. Adults over the age of 18, that sort of thing.
No.
Yeah.
I mean, I don't know. Are you asking what the government should do right now?
Well, we're thinking realistically.
Realistically, what should the government do?
Exactly. We have 2 states
Well,
already
okay, yeah, sure.
experimenting with
So,
this. Expand upon that.
sure,
When you
sure,
said
sure.
before, the states
So,
do laboratory.
8% of American adults use marijuana, 22% use cigarettes, and 55% use alcohol. Well, 8% is very low, and hardcore drugs is even lower. So the notion that the money that we spend on the drug war is completely wasted kind of doesn't hold a lot of credence because even though, yeah, sure, rates are creeping up and they're getting closer to the late 1970 usage that induced this whole war, they're still incredibly low, still very incredibly low. After the Netherlands legalized, pot use went up 100%. And, the access to children goes up. And a lot of other areas, I know that a lot of people in the marijuana debate don't like to use the gateway term, but when you move the bar, clearly, whether you want to show a scientific or not, the bar does move, and people view marijuana as acceptable, and that's what I think you're seeing in the current rise in the acceptability of marijuana, is that people believe that it's okay as a medicine. My middle school brother, he came home one day from school and he told me, no, the kids are telling me that marijuana is actually very safe and they're using it to cure cancer. And I thought this is total bullshit. I mean, the fact that opium also cures everything. You just smoke opium, you'll go to new planets. But guess what? The Food and Drug Administration made you actually turn it into a real medicine, and that's what we see today. That's what should happen with marijuana as well.
Okay, your response, and you can also talk about the health effects of various marijuana.
I want to ask if you're a scientist and if you've tested the effects of marijuana on every
I'm
single...
asking, you're not an economist either, you're not a social scientist, you're nothing. So don't come with bullshit.
Please try to watch your
Got team.
We're going to make
This
sure...
is a house of learned doctors.
I think the debaters are going to have to give each other hugs after this debate.
Yeah. I have facts. I said them before. In the treatment of Dravet syndrome, the use of medical marijuana reduced the frequency of seizures from 300 per week to 2 to 3 per month. That's a pretty drastic change. That's a pretty scientifically sound change. That probably isn't related to anything else. That's based on scientific testing based on different trials. They have found that is an actual effect, an actual medical effect of marijuana. In terms of the other stuff we talked about, it's still illegal to drive under the influence. that doesn't change if marijuana is legalized. It's still legal to do anything that you would do under the influence of alcohol that's legal. It's legal to do that under the influence of marijuana.
Can we, so
Yeah, sure.
that's absolutely true, but what we're seeing in stuff like Colorado is they've had a 30% increase in car crashes with fatalities due to the driver, well, not, I shouldn't say due to the driver, but where the driver is testing positive for marijuana. And so that's what we're arguing here. Is like he was saying, you lower the bar, you see a higher occurrence, and then we pay more money towards those situations.
I would then like to ask, why should we not ban alcohol and tobacco? Last year in the state of Texas, where I'm from, I know the facts for that. There were over 1,800 car crash fatalities due to alcohol. Why should we not ban alcohol? You talked about productivity, you talked about lowering IQ points, you talked about all these bad effects of marijuana that alcohol has the same effects, and it could be even worse than the effects from alcohol could be even worse than the effects from marijuana. There's not definitive testing on that yet. But why should we not ban alcohol or tobacco?
No, that's a valid question, and what we're talking about is lowering the bar. So something that I think is a really interesting conversation to have is whether there should be a drinking age and at what level should it be imposed. And so I think if you're having that conversation, your point is more valid, but we're talking about lowering the bar in this situation. So say we are talking about lowering the drinking age to 15. That's where I think that's a valid question. We would have to respond to your question in that way.
Okay, well, why not raise the bar? You can't consume alcohol until you're the age of 30. Why not raise the bar? You can't consume any sort of substance that would make you unable to drive a car. You can't consume caffeine. You can't consume fast food because it makes you fat. You can't do any of these things that are bad for your body, that are bad for society, that can cause you to get in a car crash.
I agree. Everyone should live in a cube, and the government just puts a little food tube. You're right. Absolutely.
Well, that's a good point. That's a good point. I mean,
Way to go.
we're in the real world here. People smoke, people do these things. How should we criminalize this? How should we, a college student who maybe, smokes a joint once in a while, something like that, if they get caught? if they
You have anything to say, Marcia?
Looking at you. But seriously, if they get caught, should that ruin their life, their career? How do we handle that? What do you guys think?
That's a good question.
Do we think that smoking marijuana should ruin your life?
Well,
No, I
I'm
think
saying
to an extent it's a valid question, and I think that's reflected somewhat in the rates that we talked about. That you're not going to be automatically put in jail, right? I think there can be fines. I think that that's a good thing. But the other thing I think that we need to realize is that we do a lot of stuff about alcohol and tobacco now that's very effective that we're not seeing the same in marijuana because this push to legalize now, right? So alcohol, you see all the ads have to say drink responsibly and whatever. Tobacco's actually even worse, and you can't advertise on TV. You can't advertise to kids. They put in those people at the school with those big fatty lungs and the big fatty heart, all that nonsense. And it's good. It's good because it reduces. I would love to see that more, right, with marijuana, and stop telling kids that it's a medicine and it's just like go escape your fears and your worries, and it's not good for you, right? And so I think that we probably could find some common ground on saying that it would be very helpful if we paid more money to divert kids from using it.
10 seconds.
Because I don't think it's helpful. So you're right, there are some things that we could probably agree on, bringing the criminalization level down from incarceration to fines and misdemeanors, but most of them already are misdemeanors.
Okay, brief response, say 30 seconds.
Okay. We agree with you on the that society should have a method of trying to discourage use. We think that organizations like Mothers Against Drunk Driving, organizations that are not the government, that try to discourage people from using these substances are good. But we don't think that the government should make anything illegal for the same. We don't think the government should make pot illegal for the same reason that we don't think the government should make alcohol or tobacco illegal. We think that there exists a point where we can get where marijuana is legal, but it's the same way as alcohol and tobacco should be.
Can I just ask why then do you think that there should be a drinking age? And why? Because you earlier argued that we wouldn't legalize marijuana for use in kids 18 and under. So if you could respond to that.
For both sides, actually, why should there be a set age at which people can consume these, or should be restrictions if you think they're bad and you think people have the inherent right to consume them?
I think that people have the inherent right to consume it. They have to know the consequence. They have to know. They have to be conscious. The same reason we have age of consent. The same reason people should not be allowed to use hard drugs that could impair them. But once you're a thinking individual and you can take decisions for yourself, and you choose what I think is choosing wrong, I think drugs are unhealthy and it's a bad life choice health-wise. But as long as you understand the trade-offs, you live in a free country and you're sure you're allowed to do what you so please.
As long as
You guys finish up this discussion, 30 seconds or
30
so,
seconds
we'll go to audience
Yeah, I
questions.
mean, as far as the legal age, I think that the important things on our side is that kids don't have access to it. Most high school seniors are 18, and therefore would be able to go to a 7-Eleven and buy their pot and distribute it to all their friends who are 15, 14, whatever. And so I think that's where you kind of run into a problem is, yes, kids can find marijuana now, but it's a lot harder than, I'm 18, I walk into the 7-Eleven, I bought my pot. I mean, it's totally different. And as far as where do you legalize, I mean, so long as you're saying that meth is okay as well, then your argument holds. But you must say that in order to be logically consistent.
Okay, we're going to move on to audience questions now. So if you have a question pertaining to drugs.
Yeah. How about Batman?
Okay, this one's do either of you guys consume coffee, sodas, anything with caffeine?
Yes.
No, we're both Mormon actually.
I consume about 3 cups a day.
Okay.
Yeah.
How about you guys?
According to a study, yeah, actually.
Yes.
Okay, according to a study by Students for Sensible Drug Policy, it's an organization actually run about 3 blocks from here in DC. They found that caffeine is twice the seriousness for withdrawal, dependence, and tolerance buildup to marijuana.
Can I ask, first of all, Students for Responsible Drug Policy is an advocacy organization, so their research, I'm not going to take it at face value.
They're not the one conducting the
Okay,
research.
but that's
Okay,
fine.
the
But hold on.
research
aside,
What is the externality of consuming nicotine to anybody? Or caffeine, whatever.
For caffeine,
Yeah,
caffeine
what's-
impairs judgment and action.
Does it cause car crashes?
Yeah.
You're telling me caffeine...
Caffeine, hyperactivity. Yeah.
What
At
coffee are you
level?
drinking?
At what level?
What coffee are you drinking, honestly?
What are you drinking?
But, I mean, okay, the rate is at 1/3 to a comparable amount, but seeing as there's more caffeine in your coffee. How about this? Alcohol.
Okay.
Probably support alcohol being allowed to be consumed by the public.
Again, no.
The intoxication rate is twice for alcohol what it is for marijuana. Yet, we sell it on pretty much every gas station and store in America. And so would you make that illegal because kids can get it? I mean, there's middle school kids that can get it because someone gets a fake ID. Your argument that because an 18-year-old
finish
can
up.
walk into a 7-Eleven doesn't hold water against any other substance.
Well, like I said, it's a lot harder to get something when you have to go find the sketchy kid in the back alley who's going to maybe give you something laced with something and whatnot. It's a lot different than when you walk into the 7-Eleven and you pull it off the shelf and you give the guy $1.99. It's a lot different. And, I mean, where do you buy your soda? Do you buy it from the sketchy man outside doing whatever in the alleyway? No, you buy it at the 7-Eleven because that's where it's easy to
The
get.
Coke man.
Which is a license.
Oh, the Coke man. Okay, sure. I don't know. I mean, it's weird to me that, the reason a store is there because it's easy. You don't go to the back alley and, out of your basement sell Coke. Well, maybe that kind of Coke, but not, Coca-Cola. So I guess my point is that, yes, I see what you're saying, and what is alcohol, but that's not what we're discussing. And I don't like alcohol, so fine, I'm with you, brother. But for the rest of everybody, I don't think that'd be popular.
Okay, so
Yeah, you guys can respond to that.
Quick response.
okay, look, it's harder to get alcohol than it is to get pot. So you need to go to a merchant that is going to be found liable for selling to children. That is a deterrent for them to do it. In the black market, there is no deterrent. And the reason why people say that marijuana is a gateway drug is because they have to buy it from the same person who sells other drugs. Now, look, let's say that you're right. Let's say that you accept that there's a fundamental trade-off you are not willing to make between the liberty of the individual of consuming alcohol and the social negative effects that it has.
Right.
And you have to have a logical, consistent argument. Where is the benchmark? Look, if there's 10 car crashes due to certain drugs, then every drug, and that's going to be your benchmark, and every drug that causes less problems, logically speaking, should be legal. And anything that causes a negative effect larger than that, it's fine. You can argue that that's where your breaking point is. But it's logically inconsistent. It is logically consistent to say that you oppose the legalization of marijuana, or you believe that alcohol and tobacco should be legal. Here.
Yeah. Yeah, expand on it. Then I'll go to audience questions. for any
Expand on
topic.
why we don't
Well,
believe
it's-
alcohol should be
Well, no,
illegal.
Actually, one other point on the
expand
safe
on-
deal.
Okay, both of you figure out what you two are going to say.
That was my fault.
You guys are wearing the
Another
same
point.
shirt, you
I
have the
know,
same
it's hard,
thoughts.
it's hard.
But they are differing in their pants. You
Sync
can't
it
see
up.
it.
Okay, well, a little too far.
Diversity.
But
Diversity.
expand on that. If marijuana was legalized, would it be safer because it would be regulated? Expand on that point.
Would it be
Instead of in the
safer
black
because
market?
it's legalized?
Yeah,
Do you mean consumption?
yeah,
Consumption?
yeah. Would it, if it's regulated,
Sure.
would it maybe not be contaminated with other substances?
So,
Would it be safer to purchase it instead of, like you
Yeah.
said, going to the sketchy kid in the back alley because it's in the black market, basically?
I don't understand why we're being so mean to the sketchy kid in the back alley. Because,
What do you want from the sketchy kid?
I don't think that there's, so what I would say is that I don't remember. What was I going to say to that? I was too caught up in my joke.
Yeah, I mean, would it be safer? Maybe.
Oh, I remember.
Sure.
So the studies coming out of Colorado right now are actually very instructive. So like I said before, 30% increase in fatal car crashes where the driver's testing positive for consumption of marijuana. So I guess we can pay attention to that for the answer to that question. We can pay attention to the case studies. That, I mean, I guess that's why I said consumption. That's why I
Okay,
clarified.
sure, whatever.
Okay, so anyway, that's I guess our answer to that question.
Okay.
Okay, brief 30-second response.
Well, we go to audience questions. I think we've had enough discussing it. How about you? You have your hand up for a while.
So let's assume marijuana is legal. Would employers still have the right to fire employees to do drug testing and fire employees who test positive for marijuana?
Yes, absolutely.
Why?
Well, they should
We
be able
don't
to,
test for
they
alcohol.
should be fired. They should be fired because they have, well,
It's very harsh.
right now, like, the law might differ, but we would argue that, you should be able to fire anybody for any reason that you want to give. You don't have nobody has like an inherent right to have a job, and as long as your employer believes that he doesn't want you in the workforce, then that's the case. There's actually good evidence to support, to advocate for firing people who use marijuana, which is the same argument that is say for firing people who use tobacco, because that increases the healthcare cost that the employer has to pay. But if that's not the case,
Okay,
still there is a right of the individual
time's
to
up.
fire.
Time's up.
Mr. Suits.
And now you can ask questions about any of the issues.
Yeah.
Any of the issues now.
So, this is Libertarian, just to go back to what you just said. So if you're saying, okay, they can fire anybody that they want to, okay? So why not do alcohol testing, first of all? And then, okay, so then why, if they can fire anybody for whatever they want, if it's been shown in Colorado that once they legalized marijuana, it went up 50%, you said? The usage went up 50%?
Yeah, I'm on.
Okay, it went up 50%. So then, if people are still going to fire them, which probably are because their production's going to go once they start smoking weed every day and going to work high, because it's legal. Okay, so why are you encouraging people to do that and basically lose their job?
We don't want to tell people what to do. That's our entire party's platform. People shouldn't be restricted in their actions by the government when they're not hurting anyone else. It's up to the employer they can fire whoever they want. And in terms of pot, if the numbers are true coming out of Colorado and it decreases productivity by so much that employers are going to fire everyone, the free market will take care of it and people will stop smoking pot. It's not really an issue that is to be debated. I mean, people
But
don't.
earlier you argued that, okay, legalizing weed is this great thing, and the government's going to get all kinds of tax dollars, and now you're kind of backpedaling.
No,
One second response.
It's up to you whether or not you want to choose to do pot. If it's not economically beneficial for you to do pot because you can't get a job, then you shouldn't do it. But that doesn't mean that the government should tell you that you can't do it.
Okay, next question.
How about top up there? I haven't seen a question.
Everyone's like saying that you can't test for alcohol, you can, it's not illegal, it's just that no one does it.
Right, yeah.
Okay,
Good point.
should we go in the back and then down back?
You can, it's legally test for alcohol.
You in the back.
This is for Yap. That statistic on the car crashes, can you repeat that statistic?
Yeah, let me find exactly where it's from. Okay, so we have a report called Legalization of Marijuana in Colorado, The Impact, that said, in Colorado, the number of fatal car crashes with drivers testing positive for marijuana rose sharply. And if I'm remembering the exact statistic correctly, I believe it's 30%.
Now, is that from the previous month or the previous January? Because if
It says it's from 2013, so it's not from this year.
all right, because it's snowing this year.
You're right. Snow
Really?
would have it.
But it says with people with marijuana in their system,
It
so
doesn't matter.
you have
if you don't
to.
have marijuana in your system, you're still more likely to crash. So
You're
Yeah,
right.
but it's compounded. It's compounded. The very, Mike,
It's a good point. I agree with you. We would need to study the validity.
If I can
I
also
agree.
you're talking
Uh,
statistically.
That's good.
Yeah.
That's good.
We're gonna move on to the next question.
How about you?
One more question.
Yes. I'm gonna
We'll have a
address.
couple more questions. and then
I'm gonna address
we can
my question to you
statements.
specifically, since I believe you'll actually answer my question instead of
Oh,
just
come
twisting
on,
around.
come on.
No, seriously, thank you. I commend you for your civility, actually. Thank
Well,
you. My question would be, are you guys Young Americans for freedom or Young Americans for liberty? Real quick.
we're Americans for freedom, yeah.
For freedom?
For freedom.
Okay. So far, this.
No, we're foundation.
Yeah, we're foundation.
Oh, I'm so sorry. Yeah,
Yikes.
we could get into a whole thing about that, but yeah, it's Young America's Foundation.
There's Young America's Foundation, Young Americans for Liberty. To actually,
I know what you're talking about.
Do you guys consider yourselves for freedom? or
We're
liberty?
foundation.
Okay. Okay. Either way, I'm just the three things that we talked about tonight, which would be gay marriage, abortion, and drugs, have all involved restricting a personal freedom to a great degree.
Right.
So I guess kind of moving off the topic to a more broad philosophical point, because I'm curious. It's just, at what point can you still say that you support liberty and take away someone's right to put whatever they want into their body as long as they're not hurting anyone, the right to choose to engage in a contract with someone else who they love,
Right.
or choose not to have children if they don't want to, or
Right.
choose not to get a job, or an employee's right to test where they want or fire whoever they want for whatever reason, so long as it's not based on race or sexual
Right.
orientation. So to what philosophical extent, other than economically,
Sure.
where does the freedom, where does the liberty that you guys have in your, that I'm assuming is in your mission statement probably,
Mhm.
where does that come from?
So what I would say then is I think that's a central question in America, and I think what's going on right now in the conservative movement or on the right is we're having that conversation. I think that's a very positive thing. Speaking for Young Americans Foundation, it's just about where you draw the line, right? So I don't know, for instance, if we're talking about drugs, where the line is drawn. I don't know where the debaters here would draw the line on drug policy, right? So if you're drawing the line at, let's say, and we're talking about all libertarians, because I would guess that there's a number of libertarians who would say, oh, let's draw the line at meth, let's draw the line at angel dust, and so then at what point can you say that you're for liberty, right? So I think that question applies not just to us, but to everyone. So, but additionally, no, I didn't even make a joke and I forgot what I was going to say this time.
okay.
What have you been smoking?
It's the coffee!
What's the other guy been drinking?
Well, I guess we'll take two more questions maybe, but only from people who haven't asked questions thus far, so we can finish up and get to conclusions. So, you have a question earlier you wanted to ask?
Mr. Bukoy.
White shirt.
Well, you guys are saying that you want to legalize things as long as it doesn't harm other people. But you guys are talking about physical harm. What about emotional harm that it causes to families and people that are dealing with addicts that are basically spending all their money, wasting their money away? My dad's a police officer in Miami-Dade Police Department, which has a huge drug issue, okay? My dad has arrested, he was actually in the narcotics team. He has arrested many white-collar workers that they were CEOs for like Royal Caribbean, and where he became a crack addict and basically spent all his money away, started even selling his daughter's toys. And so how is emotional pain not taken into account?
I don't think we can regulate emotional pain. If so, we're going to have to make it illegal to divorce anyone, to break up with anyone, to tell anyone that you don't like them. We can't regulate emotional pain.
Let me talk to that. Look,
30 seconds and we'll go to concluding.
liberty, comes the consequences of it. So if you enjoy doing drugs and you're fine, then better for you. But there's people who take drugs and just lose it, and they go down the rabbit hole and they have horrible lives. But that doesn't mean that we're entitled as a society to tell them what to do. With making wrong decisions come bad consequences. And as long as we're defending a free country, or we want to live in a free country, that's the price to pay.
And what about for cigarettes, that you have secondhand smoke. Secondhand smoke is
Yeah.
a large killer. So
Right,
why is the
absolutely. And that is closed environments depends on the owner of the place, whether they want to have smokers, non-smokers in the same area. But you're right. There are studies that proven that second-hand smoke causes damages to third party, and that should be illegal. Yeah.
And another thing.
Okay,
as well,
finish up,
marijuana
finish
smoke
up. Another
also
10, 15
affects
seconds.
Your life, your lungs. So why can't we just do THC pills instead? Why do we have to actually have the joint?
Well, could you rephrase that again?
Why do
We
we
got
have to have the joint
scientists to
instead of
figure out how
THC
that
pills?
works.
I would like.
Okay.
And like, if you want to like go become a scientist and make THC pills and whatever, you're free to do that.
Yeah.
Okay, we're gonna move on to conclusions now. You opened up the discussion on marijuana, so you'll go first on the conclusion.
We basically said all that we want to. Again, the medical marijuana, we brought that up the point, the treating different kinds of syndromes and diseases, including like seizures, cancer, glaucoma. The economic benefits of industrial hemp, which is banned, and the prison problem. I guess this didn't really come up in the debate. I'll bring it back up, but the fact Black Americans are 4 times more likely to be arrested for marijuana possession, even with similar usage rates between Black Americans and white Americans. So overall, there are just a lot of costs to keeping marijuana illegal, and there's also, we didn't notice this, there's the liberty cost. I know one of the questions brought it up.
Sorry,
But
just one thing.
there's the cost,
It
yeah.
can be encompassing all the issues
Yeah.
here.
Okay.
Sorry, I forgot to
Oh, sorry.
Is that Sherman state, the
Yeah,
statement
yeah.
for everything? Well,
Yeah,
Okay,
you
well
can-
then
you
here
can
you go.
encompass that.
Okay, we'll give you another 30 seconds.
Yeah.
Just
Okay,
some
thank you.
issues that we
Okay,
didn't
so-
have.
Look, as a concluding statement, I would like to argue it purely philosophical. It's a debate between the greatest good for the greatest number or individual autonomy. We defend individual autonomy, even though when society can be worse off in the sense of productivity, we would meet that trade-off. We think that there's a trade-off between personal liberty and perhaps the greatest good to the greatest number, but as the type of society that we wish to live in, that's the type of philosophy, the type of people that we want to be, and that we want to foster other people to be to. And you know, in the case of abortion, gay marriage, and drugs, we have to side in the side of freedom. We have to side on the right of the individual to control the decisions regarding their own body.
All right, thank you, guys. Yeah, 2 minutes.
Yeah, and I agree with them, and I respect that position. I think that we agree in a lot of areas that that personal freedom is important and it's necessary and it's a foundational part of our country. But that doesn't mean that nothing can be regulated, right? That doesn't mean that there should be no limits to what a person can do, because in the end there are externalities to what people do for other people. It does cost people when you make a choice to smoke marijuana and then go drive, even though it's criminalized. It still costs us as a society. It still costs us when you choose to abort your fetus. It deprives life from that person, and those are fundamental liberties that we are not willing to give to individuals when their actions explicitly harm other people. And so while we agree with them on the fundamentals of liberty, and we're not, both of us are not like liberals who want to take away a lot of those liberties. We still feel there has to be limits at certain places, right? In the same way that we don't think methamphetamine should be legal for everyone, and I would maybe hope that they agree. We also don't believe marijuana is productive, and the same thing with abortion. We believe that life begins at conception. If you come with those attitudes, you can't see liberty in those ways because you're harming others. And so that's where we come at this debate from, and we hope that at least you can hear what we've heard.
And if I could just say one thing really quickly, not necessarily a closing statement, just to wrap things up. The reason that we've changed out debaters is because not necessarily every single person in GWGAF, not every person in the conservative movement agrees with all of these points, agrees with our positions on all of these issues. And so I think like a really instructive thing to look at is in the libertarian movement itself, not everybody agrees on abortion. That's about a 50-50 split. And so I think that's a really positive thing that we could come together and talk about these things. I'm really happy that it went so well, and I want to thank everybody for coming out and for asking questions. I think it was a really good time, and I really appreciate it.
Thank you, everybody, for coming out. So we want to thank all of our debaters. We want to thank Chris and Emily. We want to thank Marcelo and Charlie. And we look forward to many other constructive debates between our two organizations. And fundraiser, right. PETA Pit. If you're interested in donating money to College Libertarians, it's supposed to be moderated, it's supposed to be impartial. You can go to PETA Pit now, order food, a portion of what you spend will go to the group. So thanks again so much for coming. We hope to see you all at future debates.